Welcome to Think Medicine. I'm Dr. B. Today we're going to be talking about something very interesting, Alice in Wonderland Syndrome. Alice in Wonderland Syndrome got its name from the famous Lewis Carroll novel where the protagonist Alice experiences bizarre visual distortions and strange perceptual changes. Similar to Alice's experiences, Alice in Wonderland Syndrome is characterized by unusual visual phenomena that make objects appear larger, smaller, closer, or farther away than they truly are. This rare neurological condition affects how the brain processes sensory information, leading to disorienting experiences by those who suffer from this unusual syndrome. So furthermore, as we've said before, these distortions in visual perception makes these objects appear larger, smaller, closer than they truly are. Individuals may experience a feeling of being too big or too small for their environment, just as we saw in the beloved children's movie, Alice in Wonderland. Alice in Wonderland Syndrome can also trigger visual hallucinations and illusions where people may see distorted or imaginary objects, shapes, and patterns that are not actually present in their environment. So you might be wondering, how common is this syndrome? It's a very rare brain condition. It only affects about 1 out of every 10,000 people worldwide, which is less than 1% of the population. It usually starts in childhood, with most cases being diagnosed in kids between 5 and 15 years. While the symptoms often go away in adulthood, some people continue to experience Alice in Wonderland Syndrome into their later years. So as was said before, those suffering from Alice in Wonderland Syndrome may experience these visual distortions. They see things, objects, larger or smaller than they really are. These objects can also appear closer or further away. And these visual problems are caused by the brain having trouble processing the visual information correctly. This leads to a mismatch between what the eyes see and how the brain understands it. This makes the person's surroundings feel very strange and disorienting. In addition to visual disturbances, individuals with Alice in Wonderland Syndrome can also experience auditory and tactile distortions. They may perceive sounds as muffled, distorted, or amplified, and touch sensations can feel altered or exaggerated. These sensory processing issues arise from the same neurological disruptions that cause the visual anomalies. The brain's difficulty in properly interpreting and integrating different sensory inputs leads to these unsettling perceptual experiences. Let's talk about the regions of the brain affected by Alice in Wonderland Syndrome. It's primarily associated with disruptions in the occipital lobe, the region of the brain responsible for visual processing and perception. It's thought to be caused by abnormalities in the way the brain processes and integrates visual information, leading to the characteristic perceptual distortions. While the occipital lobe is the primary area affected, it may also involve the temporal and parietal lobes, which contribute to sensory integration and spatial awareness. There is a strong correlation between Alice in Wonderland Syndrome and migraines. Individuals who experience recurrent severe headaches are significantly more likely to also develop the visual distortions and perceptual abnormalities associated with Alice in Wonderland Syndrome. Some studies have shown that up to 75% of those suffering from this syndrome also experience migraine with aura, which is a subtype of migraine that involves visual disturbances and other neurological symptoms prior to the onset of a headache. So I wanted to show you this image. We discussed the occipital lobe previously. So the occipital lobe is located at the back of the brain, plays a crucial role in the Alice in Wonderland Syndrome. So this is the region primarily responsible for visual processing and perception, and disruptions within the occipital lobe are believed to be the primary cause of the characteristic visual distortions experienced by those suffering from Alice in Wonderland Syndrome. So in this image that I'm showing you on the right here, this red arrow is pointing to this low density region in the back of the brain. This is actually caused from a stroke that this patient would have suffered. So there have been some studies that have shown that perhaps something similar to this could induce this Alice in Wonderland Syndrome. Beyond the spatial distortions and depth perception issues, individuals with Alice in Wonderland Syndrome can also experience vivid hallucinations and striking visual illusions. These perceptual aberrations further contribute to the profound sense of disorientation and detachment from reality. The brain's ability to accurately process visual information can manifest in bizarre, dreamlike hallucinations where objects, people, or entire scenes appear to shift, morph, or take on a surreal, impossible qualities. The patients may also report seeing shapes, patterns, and colors that do not exist in their actual environment. For the diagnosis and assessment of Alice in Wonderland Syndrome, first, a thorough medical history would be required, where the healthcare provider would review the patient's history of visual disturbances, the migraines, neurological conditions. Certainly a physical exam would be conducted to look to, and to assess the visual perception, spatial awareness, and sensory processing. and then neuroimaging tests, brain scans like the CT that I showed you previously, and certainly an MRI to detect any underlying neurological issues. And then also a neuropsychological evaluation would be required as well for testing of cognitive, perceptual, and behavioral functions. For the treatment and management of Alice in Wonderland syndrome, medications like anti-seizure medications or migraine treatments can help alleviate the visual distortions and hallucinations associated with Alice in Wonderland syndrome. Cognitive behavioral therapy and other psychotherapy approaches can help patients cope with the disorientation and anxiety caused by this syndrome, and also lifestyle adjustments, reducing stress, proper sleep, and avoidance of migraine triggers can help manage these symptomatic episodes and reduce their impact. Ongoing research is still required since this is such a rare condition. Researchers are utilizing cutting-edge brain imaging techniques like functional MRI and PET scans to better understand the neural mechanisms underlying the visual distortions. There may be a genetic factor that plays a role in this syndrome. There are novel treatments researchers are exploring with new pharmacological and non-pharmacological interventions, including neuromodulation therapies. And this is certainly an interdisciplinary collaboration, bringing neurology, ophthalmology, psychology, and other fields to help really advance the research behind Alice in Wonderland syndrome. Thanks for watching, you guys. If you enjoyed this video, be sure to like and comment below. Let us know if you've heard of this syndrome before, or if you know of a rare syndrome you want us to talk about on this channel. Let us know in the comments. And again, thanks for watching.